Good morning po to our media partners and to you, Sec Rosette, and our guests for today. Welcome to today's Media Forum, July 7, to provide us with updates on the current COVID-19 response of the country and other public health programs. May I please welcome DOH Undersecretary and also DOH Official Spokesperson, Yusek Maria Rosette Berhere. Good morning, Yusek.
Yes, good morning Lindsay and magandang umaga po sa inyo lahat. Happy Monday. Kamakailan lang po ay nakapagpalabas ang IATF ng protocols para sa interzonal travel ng mga fully vaccinated individuals. Nakasaad po dito sa protocol na ito na sila ay kapag sila ay naging close contact, itong protocol na ito ay mag-a-apply sa kanila. Ayon po sa IATF Resolution number 124-B Series of 2021, ang fully vaccinated individual ay ang mga taong nakatanggap na ng full 2 doses ng bakuna at may at least 2 weeks na mula nang natanggap nila ang kanilang second dose. Masasabi ring fully vaccinated ang isang tao kung ang bakunang natanggap niya ay may emergency use authorization or compassionate special permit coming from the Philippine Food and Drug Administration o kaya ay kasama ang bakuna sa emergency use listing ng World Health Organization. Kung sakaling maging close contact ang isang fully vaccinated individual, ay maaari na lamang siyang sumailalim sa 7 araw na quarantine period kung siya ay walang simptomas or asymptomatic for 7 days na lang. Kapag kailangan po ng RT-PCR test, ito ay maaring gawin ng 5 araw matapos ang last day of exposure. Kung siya naman po ay mako-contact trace matapos ng 7 araw mula sa last exposure, at wala po siyang simptomas pa rin, wala na pong kailangan na testing or quarantine na kailangan gawin. Kasabay po ng pagpapatupad ng COVID-19 response and vaccination programs at iba pang programang pangkalusugan ay patuloy po nating binabantayan ang kaganapan kaugnay sa mga aktibidades ng Bulkang Taal. At ngayong umaga po makakasama po natin si DOST Undersecretary at PhilVox Officer in Charge Dr. Renato Solidum Jr. to give us an update on the situation of Taal para din pong bigyan tayo ng ulat patungkol sa response measures ng Department of Health sa mga apektado ng Bulkang Taal. Narito rin po kasama natin si Dr. Voltaire Guadalupe. Siya po ang Disaster Risk Reduction and Management in Health Outcome Manager ng Center for Health Development 4A ng DOH. So I will give the floor now to Dr. Solidum and then we will have Dr. Voltaire after. Go ahead, Dr. Solidum.
Maraming salamat, Yusek. I will just start to share my screen. I hope you can see it now. Nakikita nyo na po?
Yes po, sir.
Okay.
Go ahead.
Maraming salamat. I will give you the Taal Volcano update very briefly. As you know, ng hapon po ng July 1 Webes, nagkaroon po ng phreatomagmatic eruption na kung saan yung magma came in contact with water in the main crater, and this caused this eruption column with height of 1 kilometer. Mapapansin nyo po, matulis po ang paggilid po ng eruption column. Yan po ay mga pira-piraso na mga initsa. At ito po ay karakteristik ng phreatomagmatic eruption. Mapapansin nyo rin po, nung nag-collapse ang column, meron nang nagsisimulang mabagal na paggalaw mula sa base papunta po sa labas ng crater. Hindi naman po talaga inabot yung buong paligid ng crater kasi maliit lamang po ang pagsabog ng Webes. Sinundan po ito ng 4 pa sa gabi na maliliit hanggang 200 meters at kinabukasan ng Friday ay 3 maliliit na 100 meters. Ang pagbuga po ng mga abo, bato at gas ay siyempre kasama doon sa eruption column, pero yung gas po ay patuloy na inilalabas ng Bukang Taal. At ito po ang satellite image ng sulfur dioxide measurement bandang 4:00 ng hapon, at mapapansin natin na palayo po sa Taal Volcano ang volcanic cloud or plume, at yung mas mapula po dyan, ibig sabihin mas madaming sulfur dioxide. Kaya lang natin pinapakita ito para maintindihan na talagang kapag high ang altitude ng eruption column o di kaya pagbuga ng gas, ito po ay ikakalat sa direksyon ng hangin. Tulad po nito, papunta sa west. At sa kasalukuyan, more or less northwest to west po ang ihip ng hangin dyan sa paligid ng Taal Volcano. Hindi naman po ito malalanghap ng mga kababayan natin kasi ito ay nasa mataas na level. Kahapon po ay nagsukat po tayo ng sulfur dioxide araw-araw po at yan po ay ginagawa kung malinaw po at ang weather ay maayos, no? Hindi umuulan. Kapag maganda po ang panahon, umiikot po ang ating makasamahan dala ang instrumento upang ma-measure ang sulfur dioxide. Yesterday, nakasukat po tayo ng mahigit 22,000 tons per day. Ito po yung pinakamataas na sulfur dioxide gas measurement. Since we started measuring it even last year, no? After the eruption, na umabot lamang sa mga close to 5,000. At ito pong more than 22,000 tons per day ay sumunod din sa previously pinakamataas na measurement ng Saturday na 14,600 plus. Kung ikukumpara po natin ang taas po nitong sulfur dioxide gas emission bago magkaroon ng explosion noong July 1 ay less than 14,000, 14,200 lamang nung Lunes and around 13,000 tons nung Huwebes ng umaga. So sa tingin natin, dahil po mukhang kapareho ang pattern, baka po magkaroon ng explosions pa rin dyan sa Taal Volcano. Kaya nagpalabas tayo ng advisory kahapon ng hapon. Kasi po sinabayan din ito ng mga lindol na nararamdaman ng bahagya ng mga kababayan natin na nasa northeastern side ng Taal Lake. At ang ating sensor po, meron tayong infrasound, special microphone, ay nagkaka-detect ng ugong or sound mula po dyan sa Taal Volcano. Ngayong umaga, nagkaroon po tayo ng volcanic tremor na nagtagal ng 45 minutes at ito pong mga lindol at tremor ay nagpapahiwatig na may pagkilos ng gas o di kaya ay magma. Ano po ba ang nangyari nung Huwebes at ano pa ang potentially pwedeng mangyari? Sa eruptions po ng Taal Volcano, marami pong estilo yan. At yung nangyari po nung Huwebes ng hapon ay tinatawag naming phreatomagmatic eruption. Ito pong phreatomagmatic eruption ay kombinasyon ng tubig at ng magma. The violent interaction of the magma with water would generate eruption columns tulad po nung nasa kanan, and this would produce posible pong marami na ash columns and sometimes laterally projected pyroclastic density currents. Ito po ay gumagalaw palayo sa crater at ang tawag niyon ay base surge. Pwede po siyang tumawid sa lawa, lalo na kung malapit ang end ng island, no? Yung lupa sa island, across naman doon sa malapit na lupa. At ito po ay nasa situation ng southwestern side ng Taal sa ilang barangay ng Agoncillo at Laurel. Kumbaga, ang tubig na tataruin ay maikli lamang at yun po ay naging dahilan kung bakit doon din po ang ating nirekomenda na evacuation. Ganon din, mas mababa ang crater wall banda doon sa southwest. Ano po ba ang material na iniitsa? Kasi minsan, importante din ito sa health hazard. Yung mga abo po na ibinubuga ay kombinasyon ng luma and magma, no? So ibig sabihin, pag magma, usually maitim at matulis na mga piraso. So yun po yung ina-expect natin sa kasalukuyan na pwedeng mangyari sa Taal Volcano. Pwede rin naman po, kung sakali nawala po yung tubig dyan sa crater ng Taal Volcano, wala nang interaction ng magma and water, ay pwede pong mag-transition ito sa weak to violent eruption of gas-charged fluid magma. Na para pong may fireworks, magkakaroon po ng lava fountaining at magpuproduce ng lava flow papunta sa baba. Kung wala naman pong eruptions na nangyayari, walang pangamba sa asphalt, pero dapat nating matandaan na patuloy ang pagbuga ng volcanic gas. No? At kapag ito pong sulfur dioxide gas ay nahalo sa isang humid air, no? Moist environment, pwede pong mababa lang ang lipad ng mga gas, no? Kaya nagkakaroon ng volcanic smog. Kung mataas naman ang itsa ng sulfur dioxide gas at steam, makikita nyo po dito sa larawan na pwede po silang ipadpad pero ito po ay nasa ere na. Dito po pinapakita yung kasalukuyang nangyayari sa Taal Volcano. Kanina po ang alas 7 yan nakuha. Ito po yung screen capture ko. Ito ay sa top left. Ito po ay nangyayari sa main crater. Makikita nyo po umuusok ang main crater. Kasama po yan ang pag-upwell ng gas. At yun po ang nag-feed doon sa mataas na steam and gas column na makikita nyo. View from Agoncillo papuntang northwest at view from Palace in the Sky. So, dalawa po ang ating pag-iingatan, pagkakaroon ng pagsabog, pwede pong tumawid sa island o pwede magkaroon ng asphalt o di kaya ay yung sulfur dioxide gas. Maraming pong salamat sa inyong lahat.
Thank you very much po, Dr. Solidum, to give us updates naman po on the ating mga response measures ng DOH sa mga apektado ng Bulkang Taal. Here is Dr. Voltaire Guadalupe po from CHT4A. Dr. Voltaire, good morning po.
Good morning, Ms. Lindsay. Thank you very much. May I request some assistance with our slide projection? Okay, so with regards to the Department of Health's response to the Taal volcano health situation with concurrent COVID response. Next slide, please. Okay, we have, of course, given out our information and education and communication materials to the public, to all of our representatives in the local municipalities and barangays of the whole of Batangas as well as the other provinces of Calabar Zone. Ang sulfur dioxide po ay asupre in Tagalog. And we have continued giving out IEC materials as well for COVID response. Next slide, please. Okay. There has been several meetings and where strategy has been discussed with regards to our updated response. Next slide. So kasama po namin ang mga officials of the Department of Health like Yusek Tong-an, Asek Laksamana. Of course, we have met with the mayors of several municipalities in Batangas affected, namely among those are Agoncillo and Laurel in Batangas. Next slide. So the situation on the ground has been assisted through the several agencies, as well, of course, as the Department of Health. As you can see, we have been giving out medical assistance, supplies, and other logistics, both for COVID and for the sulfur dioxide threat of Taal volcano. Next slide. Okay, this is in one of the evacuation centers in Agoncillo town. Next slide. Okay, this is in one of the evacuation centers of Laurel Town in Batangas, where a school is being used. Next slide, please. Okay, so with regards to the magnitude of the evacuation, as you can see, most of the evacuees are at evacuation centers are activated in Batangas province, with some in Laguna. The number of evacuation centers opened are 95, with 925 families moving into these evacuation centers. That represents approximately 3,430 individuals. Next slide, please. And since the eruption, we can see that there has been a steady increase in the number of families and individuals affected by the eruption of Taal. Next slide. And the leading causes of consultation in all of those evacuation centers is acute respiratory infection. There are some prenatal consults and some other minor complaints such as body pain, one one consult for diarrhea and one headache. So hindi pa po talaga masyadong marami ang illnesses at the moment, under control pa po. And these causes came in, or these patients came in with the complaints when they were admitted to the evacuation centers. So we have, as I mentioned, some assistance with regards to medicines. Next slide. And other COVID supplies. Next slide, please. With the total amount of assistance from the regional office of Calabar Zone amounting to 1,719,000. Next slide. And from the central office of the Department of Health, another 1.6 million, with rapid antigen test kits also being contributed by the NDRRMC. Next slide, please. So to date, what has been done is that we have already activated the Incident Command Center and the Emergency Operations Center. We are on code blue alert. There is continuous and close coordination with outcome managers, logistic officers, and transport specialists, with continuous coordination with the temporary treatment and monitoring facility managers regarding the transfer of COVID-19 asymptomatic patients from the nearby areas to the areas out of the 14-kilometer danger zone. We are on 24/7 duty at the regional OPSEN and the provincial OPSEN of Batangas. There is continuous consolidation and validation of reports from the DRRMH point persons, from the local government units up to the provincial and national offices. Next slide, please. There is continuous coordination with the quad cluster outcome managers. There is preparation of our demographics, statistics, analysis of all of the logistics and distribution. Next slide, please. So what we see that still needs to be done is today we have started the vaccination of the priority groups and the general population with regards to COVID-19. Of course, regular vaccinations should still be continued unless to address potential outbreaks of other diseases. Testing, quarantine, and referral of all suspects should be put in place and should be available when needed in all evacuation centers to address the possible surge of cases. We need to instill behavioral change among the population of the value of the minimum public health standards. Okay, next slide. And our plan of action is to institutionalize an ideal evacuation center. Okay, every time that there is a disaster, kailangan po mas mataas na po ang ating standard. We need to consider, of course, the other threats to the communities, such as, but not limited to the pandemic and the natural disasters such as the volcanic eruption. So we need to build better and safer evacuation centers and other government facilities, especially health facilities. Final reminders, we need to keep ourselves vigilant and updated. We should know our evacuation plans and safe areas. When in the danger zones, we need to evacuate with personal protective equipment. If we are outside evacuation zones, we should need to keep indoors to minimize exposure to airborne particles. Of course, continue to observe minimum public health standards, have a ready supply of food, water, and money, keep the communication lines open, and secure ourselves, our family, our pets, and our belongings. Thank you very much.
Thank you very much po, Doc. I will now be reading the questions po from our chat box addressed to our speakers. To begin with, from Red Mendoza to Director Suridum, may chance po ba na ang mga volcanic ash and plume ay maaaring umabot sa Metro Manila na maaaring matulad nung nangyari noong January? And is this reminiscent po ba ng Pinatubo explosion noong 1991 kung saan matagal itong nanahimik po its first eruption to a major eruption?
Let me answer the second question. No, it's not the same as Pinatubo. Pinatubo has not erupted prior to 1991 for 500 years. Taal volcano has been erupting quite frequently since 500 years ago. Now, the first question, pwede pa bang umabot kaya ang abo sa Metro Manila? Ay depende po yan. Kung sumabog ang Taal at mataas po ang elevation ng altitude ng pagsabog at ang hangin ay may direksyon papuntang Metro Manila, ay pwede naman po. Depende po yan. Sa lahat ng direksyon ay pwedeng abutin. Depende kung anong oras at direksyon ng hangin ang prevailing over that area at kung mataas-taas po ang altitude.
Thank you very much po, Doc. For Dr. Solidum or for Yusek Berheri po, please give the public an idea po or an advice how does sulfur dioxide affect a person's health?
I'll let the true doctor answer it. I'm a doctor, I can answer, but let me ask the medical doctor.
Dr. Guadalupe po and Yusek, maybe you can give us the responses po.
Sige, I'll let Dr. Voltaire answer first and then I'll follow.
Okay, thank you very much, Paul. Well, with regards to sulfur dioxide, the very common effects of inhalation of sulfur dioxide may be irritation of the respiratory tract. So asthmatics, of course, especially should be very much aware, and should take precautions against inhaling sulfur dioxide. Sulfur dioxide may also cause irritation of the eyes, of skin, if there is high concentration. So we need to wear protective equipment if we are in areas with the high concentration of sulfur dioxide or ash. We can wash all affected areas, especially our skin, if we come in contact with sulfur dioxide. And siguro, mas maganda po na wag ho nating papagpagin yung ating mga damit or other surfaces when we have come in contact or we have been to areas with high sulfur dioxide emissions. Thank you very much.
Yusek, would you like to add po to the response of Dr. Guadalupe?
I think that's the main effects of sulfur dioxide on our health. So that's enough.
Thank you po, Yusek. For Dr. Voltaire, may mga detect na po ba tayong suspect cases sa mga evacuation centers at magko-conduct po ba tayo ng mga testing sa mga evacuation centers?
Thank you very much for that question. At present, as per the reports gathered, the number of COVID cases is limited in the towns affected, such as Agoncillo and the surrounding areas. Konti lang po ang ating mga kaso doon, and kilala na po sila ng ating local health workers. All of them have been isolated as needed. And wala pa pong bagong dumadating. But of course, there are precautions being done. Andun po si Secretary.
Doc, I think you're on mute po.
I'm sorry? I was cut off.
Yes po,
Okay.
Doc. Nakamute po kayo kanina.
Someone is calling. Yes, ma'am. Actually, we are currently having activities, and our Secretary of Health is currently leading the vaccination activities in Agoncillo town. The suspects have identified and are in isolation. No new cases yet being reported in evacuation centers. That is a very good. Testing shall be done for suspects. Yun po mga may contact at yun po mga symptomatic. But at the moment, wala tayong urgent needs to be concerned with regards to COVID in the area. So all being taken. We do
Thank you po.
have vaccines and tests available.
Thank you po, Doc. Another question po from Red Mendoza. Nire-require po ba natin ang antigen testing sa mga evacuation centers, and will the DOH provide additional vaccine supply to the areas affected of Taal like Agoncillo and Laurel?
Yes, ma'am, Lindsay. We are providing additional vaccines as well as additional test kits with the help of the other government agencies, and the RRMC has provided more than enough test kits for the current evacuees, as well as the Department of Health has also procured enough vaccines for all of the evacuees if needed. So lahat po ng permitted na mabakunahan, meaning those above 18 years old, will be vaccinated.
Thank you very much po, Doc. Yusek, would you like to add po to the response of Dr. Guadalupe?
Yes, antigen test kits had been distributed already, as what Dr. Voltaire has mentioned. This will be used for the different evacuation sites. Also, the allocation of vaccines will be increased, and we are hoping that by vaccinating individuals and also monitoring them through antigen test kits and symptomatic monitoring, will be able to prevent further infections in the evacuation centers.
Thank you very much po, Yusek. There are several questions rin po regarding dun sa effect po ulit ng sulfur dioxide sa ating health po ng affected population. We will just be reiterating yung advisory that we have previously issued and yung mga advisories na release din po ng CHT4. Before we close po yung ating resource persons, may we get their final messages po, Yusek Solidum and Dr. Guadalupe.
Lang linawin, kahit po mag-disperse ang sulfur dioxide gas, but it's at a higher altitude, wala pong effect sa tao yon. Nandun lang yun sa taas. What it will do will probably partly block the rays of the sun and can cause some haze, but not health effects on people. Now, ang nagiging epekto po kapag malayo na po sa vicinity ng Taal Volcano, pwede pong magkaroon ng sulfur dioxide smell kung may pagbagsak na ng abo. Pero yung talagang concern dyan ay nandun lang malapit sa volcano and the Taal Lake.
Thank you very much po. Dr. Guadalupe, do you have a final message po para po sa ating media and sa public po?
Yes, thank you very much. Well, I'd probably advise that we continue our observance of the minimum public health standards, especially within the evacuation centers. Pakiramdaman po natin ang ating sarili, pakiramdaman po natin ang mga nasa paligid natin. Continue to be vigilant and don't hesitate to seek the help of our public health workers. Andun po kami, we will make our presence felt, and we will be able to get through this very soon.
Thank you very much po, Doc. Thank you very much po to our resource person.
Yes, maraming salamat, Yusek Renato Solidum and Dr. Voltaire Guadalupe for giving updates to the public and also to the media regarding the Taal Volcano incident. Salamat.
Salamat din po.
Thank you po.
Thank you po. Yusek, I will now be going through the media questions sent to us. First question po from Sheila Crisostomo. As of June 27, only 672,000 of the 2.2 million senior vaccines who got their first dose have come back for their second dose. What's the breakdown po according to vaccines, and ilang weeks or months ang allowed interval ng first and second doses? Paano po natin sila i-convince na i-take po ang kanilang second dose?
Yes, Sheila, no? So we had been constantly and regularly giving this dissemination ng mga informasyon, at saka syempre meron tayong mga per LGU na mga strategies that they do so that they can further convince the different sectors eligible for vaccination to get vaccinated. Itong ating mga breakdown per dose at per type of vaccine, we will be providing in our Viber group. Medyo marami, no? Isang table kasi, but we will be providing all of you. As to the interval in doses, we had a meeting with our all experts group last week. And based from the reports and presentation of our vaccine experts, nagpakita sila ng iba't ibang ebidensya galing sa iba't ibang types ng vaccine kung ano yung acceptable na interval between doses. So, alam natin sa bawat EUA nitong mga bakunang to, meron tayong sinabi na indicated na interval. For example, for Pfizer, you have 21 days. For Sinovac, you have 28 days, and so goes with the other vaccines. Pero may mga pagkakataon kasi na talagang namimiss ang second dose, maybe because they got infected, they got exposed and were quarantined, or meron pang ibang circumstances na nangyari kaya hindi sila nakapagpabakuna ng second dose on that scheduled date. And our vaccine experts are saying, in the existing list of vaccines that we have, ngayon, except for COVID-19, 3 to 6 months is still acceptable to give the second dose without repeating the series. Ibig sabihin, hindi ka kailangan bigyan uli ng first dose. Ibigay mo lang yung second dose immediately pag pwede na yung tao. Pero may specific na mga reports na or evidences na nakuha ang ating mga vaccine experts kung saan nagsaad for Pfizer, ayon sa US CDC, you can give it as long as 42 days. Yung bakuna. So that means dalawang beses na 21 days. No? So it means you can delay it for another 3 weeks. For Moderna, ganun din, 6 na linggo, 42 days. For Sinovac, sinabi, walang kailangan, basta ibigay as soon as possible na pwedeng ibigay. Wala siyang sinabing time period. And for Sputnik V, sinabi hanggang 90 days pwede mong ibigay yung second dose mo. So these were the presentations of our all experts group coming from our vaccine experts. And accordingly, sinabi na rin ng ating mga eksperto, hanggang mga 6 na buwan, hindi mo pa rin kailangan mag-repeat ng series, you can still give the second dose of the vaccine.
Thank you po, Yusek. Also from Sheila, 17 months into the pandemic, what are the long-haul effects of COVID-19 on infected individuals that DOH has observed?
Yes, yun pa rin. Marami ang na-observe natin, anecdotal reports and official reports coming from our vaccination or our CHDs, regional offices. Yung headaches, meron yung sinasabi nila yung kanilang breathing hindi na parang naging bumalik sa dati, no, that when they have difficulty in exercising right now, yun yung mga nararamdaman nila. Yung iba naman meron pa ring sinasabi na parang paunti-unti na cough after they get or recovered from COVID, no? So all of these are being compiled, consolidated, and there are different groups in the country that are doing these studies already. Kailangan kasi nito mahabang pag-aaral. We do a cohorting study kung saan yung mga taong nagkaroon ng sakit, i-observe mo siya for a long time. So sa ngayon, wala pa tayong maibibigay na ebidensya talaga na coming from a study. But these are the reports that we are getting for now.
Thank you very much po, Yusek. We have several data requests po from Caroline Bungking regarding the contact tracing ratio and vaccination data per region po. Ilang percent ng target population per region ang nabakunahan? Ano so far ang lugar na pinakamataas ng vaccination rate? And kaya po ba ang population protection sa Metro Manila by November as Malacanang said?
Unang-una, Caroline, no? So for the rest of the details that you would want, we will be posting this in our Viber group. For the contact tracing ratio, ngayon nationally, we have 1:6. Pero pag tinignan natin sa bawat region natin, iba-iba. Meron tayong matataas na regions na nakakapagtala ng 1:13 na contact tracing ratio. Ito ay Region 5. Meron din tayo 1:10 sa Region 4A at saka sa Region 11. Dito sa National Capital Region, kapareho ng national, 1:6 tayo ngayon sa contact tracing ratio. So all of this will be provided to all of you, but just so that I want to refer also the questions sa DILG kasi sila po naman talaga ang overseer ng contact tracing efforts natin sa country para po mas maging kompleto ang detalye natin.
Yusek, for the last question po, will we achieve for the last question of Caroline Bungkin, will we be able to achieve population protection in Metro Manila by November as what the Malacanang said?
Well, based from the speed and the scale of how we are doing our vaccination here in the National Capital Region, may posibilidad na ma-achieve natin yung population protection. Pero kailangan maintindihan natin what are the components for us to say that there is population protection. Aside from having this certain percentage of vaccinated individuals, kailangan masiguro rin natin na yung senior citizens at saka yung mga taong may comorbidities ay na-achieve din natin yung ating tina-target na mabakunahan among them, so that we can really say that we have protected the population. So aside from maybe achieving 50% of the population vaccinated with COVID-19 among the population here in Metro Manila, there should be that among these 50% vaccinated, kailangan mataas din yung na-achieve natin na pagbabakuna ng matatanda at saka mataas din ang pagbabakuna ng mga taong merong mga sakit or comorbidities. In that sense, we can really say that we have protected the population.
Thank you very much po, Yusek. From Greg Gregorio, may we get DOH reaction on Senator Pacquiao's allegation that the DOH is buying nearly expiring medicines at a regular price instead of a cheaper price? He said this is according to an independent group po.
So we have protocols and there are specific agencies of government and we have different laws that would say na hindi kami pwedeng bumili ng mga near expiring. Meron po kami mga polisiya tungkol dyan na ang pwede lang naming tanggapin at i-procure ng mga gamot ay may shelf life na 18 to 24 months. Meron lang ho mga instances na may mga polisiya din tayong ipinalabas na kapag tayo ay may public health emergency, we can be able to procure said medications or drugs or supply na 12 months naman ang kanyang shelf life dahil nga kailangan na ng ating bansa. Pero yun pong bumili para po magkaroon ng discount ba or I don't know what kind of negotiations, I can say na wala po kami na mga ganyan, no, na mga nabibili na mga supplies or mga gamot because we are following the existing policies and laws of government. Ngayon, inaantay pa rin naman po namin ang mga dokumento or queries ni Senator Pacquiao para po we can appropriately address all of them and submit to his office again documents that may respond to these questions that he has.
Thank you, Yusek. Does the DOH recommend antibody testing to know if an individual has already generated protection or immunity after having two doses of COVID-19 vaccine?
No, we don't recommend that. No, so we have been saying this for a very long time already because this might mislead people. No, so marami pong nagpapa-antibody testing sa ating mga kababayan pagkatapos sila mabakunahan para mapakita daw kung nagiging protektado sila sa bakuna na naibigay sa kanila. Maari lang po na mapaalala namin sa inyong lahat. Unang-una, hindi lang po antibodies ang pinoproduce ng ating katawan kapag tayo ay binabakunahan. Meron pa rin hong ibang type of immunity that our body generates when we are vaccinated. And this is the cell type of immunity. So hindi yan makikita sa antibodies na kukunin natin. So pag nagpa-test tayo ng antibody at nakita nating mababa, hindi po ibig sabihin yan ay hindi kayo protektado ng inyong bakuna. Kailangan ho natin bigyan ng kumpiyansa ang ating bakuna. Inirekomenda ng ating mga eksperto, hindi mo kailangan magpa-test ng antibody. Unang-una, dahil wala pa talagang test. As sinasabi, there is no validated test yet to measure the correlates of protection. That's why it is not recommended. So yung mga rapid antibody test na meron tayo or kahit yung mga antibody tests sa mga laboratorio na meron tayo sa ngayon existing in the country, they are not recommended for us to measure if we were protected by the vaccine or not. All of these vaccines that we have right now in the country and is being used for our population ay masasabi nating epektibo. Lumabas na ho ang real-world studies natin at nagpakita po na good performance lahat ng bakuna na meron tayo dito sa ating bansa that will give us protection for severe infections, from hospitalizations, and from death. Kinsey?
Thank you, Yusek. We have several questions po regarding Octa's data or risk classification. From Caroline Bongkin, sa data ng Octa, based daw po sa CDC and COVID Act Now metrics, moderate risk ang COVID incidence rate sa bansa, pero high risk ang ibang lugar tulad ng Iloilo and Davao cities. Sang-ayon po ba ang DOH dito? Pareho po ba ang data? Last week po kasi nabanggit ni Director Thea na low risk na ang COVID-19 classification sa bansa. Salamat po.
Yes, no? So, Caroline, yung metrics at saka yung cut-offs na ginagamit ng Okta when they had a moderate risk classification is different from ours. Ang metrics namin refers to case transmission risk. At yung kanila naman, ini-include pa rin nila yung healthcare capacity metric. So, kailangan po nating maintindihan maigi so that we can interpret properly. I just like to tell everybody that when Director Thea has mentioned this in a public briefing among the media and the public, sinabi niya ho yan factually. It was stated factually because it is really being computed. No, every time that we do this risk classification, the national classification is also included. And it lumalabas yan sa mga situation reports din po natin. So when we say it's low risk for the national, kailangan maintindihan din natin what's happening across the different regions. It's not just a national picture that we look at. So pag tinignan ho natin, nasa low risk nga ang national, pero pag tinignan natin, marami pa rin pong mga regions natin ang nasa moderate to high risk. That's why we say the situation is very fragile at hindi kailangan maging complacent at this point in time.
Thank you po, Yusek. I think your answer po answers Jessel's Ricafort's question na rin po. So from Caroline Bongkin Yusek, ang initial na usapan po ay 50-50 ang government at private sector, pero may mga nagsasabi po na mas kaunti ang expected allocation ang naibigay sa ibang company. Can the DOH provide information po ilang percent ng vaccines through private sector procurement ang naibigay ng private sector?
For that, I will defer. No, I'm sorry, but we need to defer to the vaccine cluster, kila Secretary Galvez regarding this matter. As far as the information, what information we have right now, ang mga dumating na for the private na mga bakuna, nagkaroon na tayo ng 500,000 from Sinovac para dito sa Philippine Chamber. Chinese Chamber, and also nagkaroon na rin tayo ng 99,600 for the International Container Terminal Services. No? So yun lang po ang impormasyon natin. Hindi ko po masasagot itong 50-50 agreements and how much went to the private and the different companies that are included into their consolidated procurement. I guess maybe Secretary Joey Concepcion or Secretary Galvez can answer that question.
Thank you po, Yusek. From Sheila Crisostomo, local travelers will now be exempted from swab testing if they are fully vaccinated. How will the government validate vaccination cards when many local government units, especially in the provinces, use coupon bonds without photograph of recipients and control numbers and reproduced using Xerox machines? Meron silang online registration system pero hindi po talaga nagagamit yung scheduling sa actual vaccination.
Yes, no. So Sheila, unang-una itong ating binigay na bagong protocol about fully vaccinated individuals. Kailangan natin balikan, no, yung ating mga protocols. And ang sabi natin, dati kahit walang testing, as long as we do symptomatic screening, we can be able to ensure that we have screened the individual who's coming in our borders, and we can be able to say na pwede natin sila i-quarantine kung sakaling sila ay may simptomas, ma-isolate o kaya ay sila ay exposed. Ngayon itong binigay natin na protocol na maari ng mag-interzonal travel ang isang fully vaccinated, they just have their vaccination cards ipakita. Kailangan, ito pong gagawin natin, ang sabi nga natin sa IATF, ang rekomendasyon, it has to be uniformly implemented. Ibig sabihin, itong binibigay po natin na incentives for fully vaccinated, lahat dapat ng local government should be able to implement this also. Na hindi mo na kailangan hingan pa na mag-quarantine o kaya mag-test ng RT-PCR or antigen ang ating mga kababayan na pupunta sa inyong lugar. Ito pong issue sa vaccination cards, we hope and we have given advice na because of this protocol, kailangan mag-improve po ang ating mga local governments that they be able to issue a card, a vaccination card, which is more legitimate at mas magagamit ng ating mga kababayan when they do their interzonal travel. So hopefully, ito pong lahat ng kailangan gawin na detalye sa proseso ng operations, maiaayos po natin para mas maganda po ang pagpapatupad natin dito. Bottom line dito, sinasabi natin sa mga tao, if you are fully vaccinated, you are protected and yung ating mga protocols na meron tayo sa ngayon, maaari nating i-ease ang ating mga restrictions dahil alam po namin na protektado kayo nito mga bakunang meron tayo.
Thank you po, Yusek. I will now be reading some questions po sent through our chat box from Rafael Bosano. Ano po ang nakikitang effect ng DOH sa COVID-19 situation matapos ang Taal eruption at ang posibleng pagdating ng mga bagyo sa mga susunod na buwan?
Well, Rafi, alam natin kung ano ang pwede maging epekto, no? Because usually when there are this kind of calamities, katulad niya, nag-aalburuto ang Taal Volcano, katulad ng we are now in the rainy season, na marami na mga bagyo na pwedeng mangyari sa ating bansa, ang unang-unang iniisip natin would be evacuating those individuals who are vulnerable to this kind of calamities. And when we evacuate them, of course, we put them in a place away from their homes at magkakasama sila sa isang lugar. And that is the threat and that is the risk for all of us. That's why ang atin pong mga health emergency and management units natin sa bawat rehiyon, ang atin pong National Disaster Risk Reduction Management Committee ay council ay sila po ay naghahanda na, no, for these upcoming calamities. Para kapag tayo ay nag-evacuate, we will be assured na wala pong further na hawaan na mangyayari. So how will we do that? May standards po tayo para sa isang evacuation site to prevent transmission of disease. Meron po tayong mga binibigay na mga assistance sa ating mga local governments whenever these things happen so that we can provide masks, nakapag-provide po tayo ng iba't ibang mga suporta para hindi magkakahawaan ng ating mga kababayan. And third, importante po, pag may mga ganitong pagkakataon, mas maganda at ang ating rekomendasyon din po, and iyan naman po ang ginagawa ng gobyerno, na makapagbigay tayo ng karagdagang bakuna para mas maprotektahan po natin ang ating mga kababayan na makakaranas ng ganitong mga pangyayari.
Thank you, Yusek. From Maki Pulido, may I ask for updates on Delta variant monitoring in the Philippines? Could you please explain po again kung ano po yung Delta variant po?
Well, the Delta variant, Maki, is a type of mutation of this coronavirus, SARS-CoV-2. Ito pong Delta variant na ito ay meron siyang dalawang specific na mutations, kaya siya ay sinasabing mas nakapanghahawa. Siya ay meron siyang dalawang mutations that can mimic also the UK variant and the South African variant. But ang sinasabi, kahit minimimic niya yung UK variant, siya ay mas nakapanghahawa. Kung ang UK variant, nakakapanghawa siya ng mga 4 na tao hanggang 5, ang Delta variant po 5 hanggang 8 tao ang pwede niya mapanghawaan. So just imagine one person, katulad nung nangyari po sa Australia, no, yung driver ng limousine, yung kanyang pagdadrive lang doon sa mga crew members ay nagkaroon na po ng mga sakit, no, doon sa Australia. Ang sinasabi rin ng ating eksperto, seconds lang po ang kailangan for a Delta variant na matransmit niya sa isang tao. So ganun po siya ka-transmissible, ganun po siya ka-infectious, and kaya po pinag-iingatan ng lahat ng bansa itong Delta variant that it will not cross their borders kasi we are seeing right now increase in the number of cases in specific countries in the world kung saan mataas na po ang kanilang vaccination rate pero nagkakaroon pa rin po sila ng pagtaas ng kaso. And this is because of the Delta variant's characteristic, no, of affecting the immunity that vaccines give to a certain person. Kaya kailangan po natin talaga mag-ingat. Dito po sa ating bansa, 17 pa lang po ang ating nadidetect. Lahat po sila ay nadetect natin through our borders. They are all returning overseas Filipinos at tayo po ay nakakasiguro na na-isolate natin sila ng kumpleto. Meron lang pong isa na binawian ng buhay. 16 naman po ay recovered na sila at nakakumpleto ng isolation, and the local governments are currently monitoring them regularly. So wala pa tayong dapat ipangamba sa ngayon, pero ang tanging paalala sa lahat ng ating mga kababayan na sana po tayo ay mag-comply sa ating mga safety protocols. Kahit ano pong variants ang meron at pumasok sa ating bansa, kung tayo po ay susunod sa mga minimum public health standards, kung atin pong maipapatupad ng maayos ang ating mga protocol sa iba't ibang settings dito sa ating bansa, we will be protected from these variants. So tuloy-tuloy lang po tayo, sama-sama tayong lumaban dito po sa mga variants na meron na ngayon.
Thank you po, Yusek. From Jessel Ricafort. Per NTF spokesperson Major General Padilla, there will be a body system daw po para sa mga bakunador. Can you give us more information about this po? May sapat po ba tayong vaccinators for this new system?
Well, it will depend on the local governments. Siguro yan yung sinasabi ni General Padilla na oo, sinabi na nga natin kailangan sa isang vaccination site meron tayong overseer, meron tayong supervisor para iniikot niya lahat ng vaccine stations dun sa kanyang vaccination site to ensure that processes are being followed strictly. Ngayon, kung meron tayong extra pa na human resource, mga kadre, mga volunteer, pwede naman po ng body system yan. Maganda rin pong rekomendasyon yan dahil maaari po tayo magkaroon ng pagpahinga nitong ating mga bakunador. Yung isa naman, yung body naman niya ang gagawa. And this body system can also ensure na tama yung prosesong ginagawa. May check and balance tayo. So kung dun po sa mga local governments na meron po silang extra na staff at gusto nilang gawin ito, we will fully support that because we know that that can be able to help us in this process for our vaccination.
Thank you po, Yusek. From Red Mendoza, may ilang LGUs po ang hindi na naman magtutuloy ng kanilang first dose vaccination such as Makati and Muntinlupa City. Can the DOH say ano po yung mga posibleng dahilan kung bakit may delay po, and if so, bakit hanggang ngayon ganun pa rin po ang dating ng supplies nila?
Supply pa rin ang ating issue, So hindi naman po yung kontrolado ng ating gobyerno, hindi rin po yung kontrolado ng ating mga local governments. Ang atin pong masasabi lang, pinahangaan natin ang mga local governments because bibigyan sila ng bakuna, agad-agad nauubos po nila dahil gustong-gusto na nilang makover at maprotektahan ang kanilang mga constituents. Dumadating lang tayo dun sa punto talaga na because the supplies are delayed, wala po tayong maibigay na karagdagan pa na bakuna sa ating mga local governments. So dadating po ang ating mga supplies maybe on the second week of July at dito po mare-replenish natin ang mga stock. So kung ano man pong mga stocks ang meron pa ang local governments natin, pinagpapatuloy po nila. Ngunit ang paalala lang po namin galing sa Kagawaran ng Kalusugan, ngayong pong medyo kumukonti ang supplies ng mga bakuna, unahin po natin yung ating mga vulnerable sector like the A1, A2, and A3 sector para makapagbigay po tayo ng proteksyon sa ating populasyon.
Thank you, Yusek. First, from Sofia Toma Cruz, has the DOST study on mixing and matching vaccines started? If not, why? What is the new target start date? Thank you po.
Yes, So kailangan lang natin asikasuhin, kasi malaking fund ang kailangan dito sa mixing and matching na study na sinasagawa ng Department of Science and Technology together with DOH. But what we have right now would be that the proposal is there already, na pag-usapan na, naiayos na, we're able to finalize already. Yun na lang ating mga memorandum of agreement, the usual processing of specific documents because of the funds that will be used ang ating sila sa ayos ngayon. Magbibigay tayo ng information when this will be started. Pero kailangan ko lang sabihin sa ating public at saka sa ating media partners, hindi po nakasalalay ang pagpapatupad natin ng ating mga protocols or revised protocols dito sa ating bansa with this kind of studies. Itong mga studies na sinasagawa natin dito, these are supplements to whatever international evidence we already have. So pag nakakita tayo at ang ating mga eksperto ng sufficient evidence already for this specific strategies katulad ng mixing and matching at nairekomenda naman ng ating mga eksperto na hindi natin kailangang antayin ang mga ganitong pag-aaral. Itong mga pag-aaral na to will provide us further evidence kapag natapos ito.
Thank you po, Yusek. From Sheila Crisostomo po, meron po ba tayong mga safety nets ngayon para hindi na maulit yung mga nare-report po na pagbebenta ng vaccines?
Yes, So kailangan ho natin maintindihan na ito pong mga nangyaring ito, bagamat iimbestigahan pa natin, meron ho naman talaga mga safety nets. Kahit mga local governments, meron po sila. Narinig niyo po si Mayor Isko noon. Nasabi nila, Sabi ni Mayor, talagang bantay sarado sa kanila ang bakuna at hindi manggagaling sa kanila yung bakuna na yan. At ganun din po sa national government at sa ibang local government. So these safety nets are there. We specifically guard strictly itong ating mga bakuna. And of course, ngayon po, mas aware na ang ating mga kababayan, lalong-lalo na, at saka po yung ating mga vaccination sites. So siguro naman po ay ngayon mas mababantayan din natin na wala na talagang mangyayaring ganito in the future.
Thank you po, Yusek. From Maki Pulido and Caroline Bungkin po, experts say na fully vaccinated people can still be carriers. Can this impact transmission now that fully vaccinated are allowed internal travel?
Lagi tayong nagsasabi, no, kapag nagpapatupad tayo ng easing of restrictions, we have safeguards na pina-follow. So hindi po tayo mag-i-ease ng restriction na yan kung alam natin na wala tayong pang second option or pang backup dyan. So what we do, we have the fully vaccinated who can travel interzonal. And oo, tama yan, pwede pa rin silang mahawa, pwede rin silang makapanghawa kahit fully vaccinated, pero may safeguards tayo. Kaya sinasabi natin sa local governments, there has to be strict symptom screening, kailangan may monitoring tayo. Kailangan din na as soon as may mararamdaman ng isang fully vaccinated, kailangan tumulong din kayo, isolate yourself agad. So the existing protocols that we have right now are the safeguards that we have, even though we are easing some of the restrictions, especially for these fully vaccinated individuals. But it will also be unfair kasi for those fully vaccinated na hindi natin bigyan ng kumpiyansa dahil protektado na po sila. Yun lang nga lamang po, kailangan lahat po tayo, even if you are vaccinated fully, sumusunod pa rin tayo doon sa mga protocols na meron tayo sa ngayon.
Thank you po, Yusek. From Aiko Miguel po, according to UP Pandemic Response Team and Octa Research Team, posibleng tumaas po ang COVID-19 cases sa ilang bahagi ng Luzon dahil sa evacuation ng mga tao sa pag-aalboroto ng Taal at paparating na mga bagyo. Ano po ang mahigpit na bilin ng DOH sa mga LGU ngayon, lalo na sa Batangas na may evacuees na po? Dapat din po ba nating bigyan ng prioridad na mabakunahan ng mga Taal Volcano evacuees upang mapigilan ang hawaan ng COVID-19? And lastly po, Yusek, ano po ang paalala po natin sa DOH? Ano po ang paalala ng DOH sa paghahanda ng mga LGU sa mga paparating na bagyo ngayong may pandemya?
Sige, thank you. Ang dami. Sige. Unang-una, yun pong sa pagbabakuna, nasagot ko na po yun kanina, no? So naging direksyon na rin po yan at desisyon ng ating vaccine cluster together, of course, with our officials na talagang dadagdagan po natin yung mga allocations natin ng bakuna sa mga piling lugar na ito. Dahil gusto natin maprotektahan yung ating mga kababayan na nandun sa mga evacuation sites and also affected by this kind of incidents. Pangalawa, yun pong pagpapaalala natin in our evacuation sites para sa ating mga kababayan, para sa ating mga local government officials, kailangan po lagi tayong handa, kailangan po natin mapanatili na hindi po magkakaroon ng hawa-hawaan dito sa ating vaccination sites. So para po natin mapanatili na talagang meron ho tayong safety protocols dyan, kailangan merong distance ang bawat pamilya sa bawat isa. Kung maaring gumamit ng mga eskwelahan na merong mga maraming kwarto na maaring magkaroon ng isang pamilya per room kung sakasakaling posible lang po para mas safe tayo. Kung hindi naman, nakikita ko po doon sa ibang evacuation sites, they have their own parang tent per family, no? So kung magagamit natin yon, because these are also engineering controls, barrier po yan para dyan. Pinaka-importante, lahat ng tao sa loob ng vaccination site should be wearing their face mask, no? Yan po, number 1 po. Keep ventilated yung mga evacuation sites. So wag ho tayong maglagay ng evacuation site na mga enclosed. Mas maganda na po yung bukas ang hangin ay ang daloy ay maganda kaysa nandun tayo sa isang sukob na isang lugar na maaring ang infeksyon ay manatili at magkaroon ng ating mga evacuees. Kailangan din po natin ng baseline monitoring ng lahat ng ini-evacuate natin. That's the reason we're giving you antigen test kits para matest nyo po lahat ng ating papasok sa ating evacuation site. We can appropriately monitor them. And of course, yun pong pag-uugas ng kamay, maglagay ho tayo ng sanitation area dyan sa evacuation sites where they can always wash their hands with soap and water. Magbigay ho tayo ng mga alcohol sa bawat pamilya para lagi po nilang na nasa-sanitize ang kanilang kamay. And of course, ang pinaka-importante, kung makakapagpabakuna po kayong lahat dyan based from the local government's allocation para po madagdagan ang proteksyon nyo laban dito po sa COVID-19.
Thank you po, Yusek. I think last question na po from Dreo Calonzo. If you have the data now po, Yusek, ano po ang latest data natin on the average daily administered doses in the last 7 days? And do we expect it po na bumaba po ito given the constraints in supplies in the coming weeks?
Oh, well, lagi natin sinasabing, Dreo, no? It's dependent on supply. So ito pong mga average daily jobs natin, yung 7-day moving average, depende po yan sa supply at saka sa bilis ng pagbabakuna or yung proseso ng pagbabakuna. So sa ngayon, hindi naman natin sinabing zero na lahat ng ating vaccination sites with these vaccines. Yung mga iba pa lang hong local governments ang nagsasabi na wala na sila for specific sectors ng kanilang population sa kanilang lugar o kaya for first dose wala na sila but second dose meron pa rin sila. So kailangan maintindihan po natin itong mga circumstances na to. So maaari na maapektuhan ang ating daily jobs or itong 7-day moving average with the supplies and the speed in vaccinating. So sa ngayon po ang ating current is 236,867. That's our 7-day moving average para po dito sa current time period natin. But as you have said, maaari pong maapektuhan because of the supplies and the speed in vaccinating.
Opo, Yusek, sorry, may last pahabol questions na po tayo from Jenna and Maki Pulido. Sino daw po yung may access natin sa vaccine supply and who can bring it out of the storage?
Well, it depends on what storage. If we're talking about the storage for the national, it's going to be our logistics team headed by DOH. But they receive, ang DOH po nakaka-receive ng allocation list coming from the vaccine cluster headed by Secretary Galvez and Yusek Mirna as her deputy and Sec Vince Dizon. So pag na-receive na po itong mga allocations na ito galing sa vaccine cluster, ang DOH naman po headed by Undersecretary Carol Taino, siya po yung may authority para magsabi na i-distribute na natin yan sa iba't ibang bahagi ng ating bansa. Ngayon, pagdating sa local governments, it's going to be the local chief executive that has the authority to say kung magre-release sila ng bakuna to certain vaccination sites or not.
Thank you po, Yusek. Before we officially end our media forum for today, do you have any further messages po to the public and to our media?
Yes, no? So gusto lang ho natin magpasalamat kay Dr. Renato Solidum Jr. at saka kay Dr. Voltaire Guadalupe galing from our regions 4A or CHD 4A ng DOH po sa pagpapaunlak ng aming imbitasyon at nakapagbigay ng update sa Bulkang Taal at sa mga aksyon ng DOH na isinasagawa para sa mga apektadong residente. Panawagan po sa ating mga kababayan sa evacuation centers na kung maari lang po, sumunod po tayo lahat sa sinasabi ng ating local government at saka ng ating DOH officials dyan. Sumunod po tayo sa minimum health protocols. Ang banta po ng COVID-19 ay narito pa rin kaya ang pagsusuot ng face mask at saka face shield, ang pag-physical distancing at saka yung palagi ang pag-uugas ng kamay ay napaka-importante upang tayo ay may sapat na proteksyon. Hindi lamang po yan sa COVID-19, ngunit pati na rin po sa mga panganib ng chemical galing sa bulkan. Ang DOH po ay handang maghatid ng tulong at rumisponde sa mga pangangailangang pangkalusugan sa ating mga apektadong mamamayan. Sa panahong ito, hangad natin ang pagkakaisa at pagtutulungan ng lahat upang maprotektahan po natin ang isa't isa. So maraming salamat po sa inyong lahat. Happy Monday. Thank you, Lindsay. And we'll see you on Friday. Salamat.
Thank you very much po, Yusek. Thank you to our media partners. Have a good day po.